Hi, everyone. Thanks for joining us. This is Karen Fortuna, and today I'm going to be talking about the digital peer support competencies. And as we know, as peer support has expanded across the globe through the use of technologies such as video games or virtual reality or the telephone, it's really important to develop a framework around digital peer support competencies for consistency and really standardization of the actual best practices. And so with our group, we had organized 59 peer support specialists from around the world, and we brought individuals together through a list. Through a list here, we recruited individuals, then we brought individuals together in a virtual environment, and together we defined what are the core competencies that a peer support specialist should have as they're delivering peer support services. And the first competency that individuals identified, which was the most prevalency, was protecting the right of service users. And so this is around confidentiality, security, privacy, and informed consent with the individual. So peer support specialists mentioned telehealth rules are going to affect what you can and can't do. Multiple peer support specialists reported understanding and evaluating the security features of the technology as incredibly essential for digital peer support, for the peer support specialist, and also for the service user to ensure that there is informed consent around using the technology. And so one example of what an individual had stated was that one piece of essential knowledge is that we evaluate the security and privacy aspects of a digital platform, and guidelines for confidentiality protections were frequently encouraged, and that people need these specific types of guidelines. And what this is really about is transparency, which is so incredibly important when working with individuals who may have experienced marginalization, maybe discrimination among the mental health or substance use or even primary care programs. And to conclude here, one of the peer support specialists said, it's about transparency and trust. If their information is being shared, or if I can see their phone number, I'm going to be honest. We have to do that, to be upfront. So the next focus and the next theme that came up throughout these conversations with these 59 peer support specialists came up was around technical knowledge and skills in the practice of digital peer support. Here, peer support specialists recommended that digital peer support specialists should have the knowledge necessary to comfortably use technology during a meeting with an individual. And now know the technology can be a telephone. It doesn't have to be virtual reality, but if that's how they want to connect, then that's also how they want to connect. So the peer support specialist should be comfortable. They should have the basic skills to use different platforms or devices and be offered education on how to do that. And they also recommended that peer support specialists have the ability to teach service users how to access and comfortably use digital platforms, devices, and also resources. So a really great quote from our colleagues is that digital peer support specialists need some basic knowledge of computers and a virtual format, like accessing platforms such as Zoom, not only to be able to navigate it, but to teach others how to access it and navigate it on different platforms, like a computer or a mobile phone. And here, note too, that peer support specialists said it doesn't always have to be technology. It can be a blend of digital and non-digital resources. It's really based on meeting the participant or the individual you're serving where they are. One colleague wrote, I mail out the material before the virtual group so I can see if there's any additional questions, and teaching people how to screen share or whatnot. So the next competency was around available technologies. Here, peer support specialists emphasized how the preferred type of device or digital platform may vary by individual, may vary by age, may vary by mental health condition, or how an individual wants to communicate through the telephone, through a webcam, through having their video off, potentially. So here, many peer support specialists have suggested that, yeah, there's technology preferences. And here we can work with people to identify their preferences and to support them in accessing support services through their own preferences. Next is equity of access. And what this means is that we should ensure that everyone has equal access to technology and take into consideration the physical challenges that an individual may have. Also the accessibility of platforms within particular types of environmental challenges, such as not having Wi-Fi. And also cultural competence in our use of technology as well. So here, the ability to connect with service users from different backgrounds and culture is an essential ability. And so one of the quotes is that, well, I think that engagement is a cultural matter of having cultural humility and understanding and empathy for a person's worldview, and being able to meet a person where they are, whether it's a rural situation, whether it's in a homeless situation, whether it's in an urban high-rise. There needs to be a way that a specialist can extend him or herself to make an effort to understand the environment out of which a person is served and where they are at. Peer support specialists also indicated gaining a knowledge of technical resources for a particular population, such as people who are in rural areas. And so having the tools and being proactive, knowing that, well, potentially there may not be Wi-Fi in this area. So let's use technologies that have adaptive services, such as things like WhatsApp that can work in a place where it is low Wi-Fi. All right, and then the next part is around digital communication skills. Here, peer support specialists reported effective communication is a necessary component to digital peer support. With the lack of body knowledge, language, and at times the lack of visual interaction, peer support specialists recommended that they rely on verbal cues and engagement skills in interacting with individuals. So having good digital communication skills. And so this could be text messaging with an individual. And it could be other things such as telephone calls and good facilitation skills with the individual as well. And focusing on that building of the relationship, no matter what technology an individual is using. So next, performance-based training. So it's really important to attend a digital peer support course. One individual stated, I think that digital peer support course would really be helpful for individuals. And it'd be cool if there was another layer of training. So for a specific agency, if there were certain regulations that were different, or if there were certain requirements on different policy levels. So then also having competency quizzes for individuals to check back to make sure that people are understanding the information that people are receiving in these performance-based trainings. Next is self-care. So here, this is for the peer support specialists themselves to take a break from digital peer support, understand there could be digital fatigue for the peer support specialist and the service user. And so really relying on the skills or developing the skills around self-care for the peer, and knowing that in-person relationships are different than digital relationships, how it can exhaust the body and exhaust our cognition using different types of technologies. Next, monitoring digital peer support and addressing a digital crisis. So understanding a role of a peer support specialist, which is very different than other kinds of service providers in these crisis types of situations. One peer said it as a peer specialist, it's not the person who is geared or trained to respond to a full-fledged crisis. By nature, most peer support specialists in their emergency response setting are not trained or orientated to address a crisis situation. So they suggested that if it's not a training, even just a communication about how to respond to a crisis virtually and having understanding about that. What if someone text messages you at 3 a.m. and someone is reporting a crisis and this is a person served, or they're on Facebook and saying the same things? And so understanding how you address that, every agency should have a way that not only providers address it, but also peer support specialists as well. And then next, within all of this, the technology is just the facilitator of the human connection. Everyone must have their certified peer support specialist training or their certified recovery coach training. And then digital peer support is added on top of that as an endorsement for individuals. Understanding peer support is an essential ability, and it's really the fundamentals of all of the support services. Understanding that the technology facilitates the peer support and integrating peer support through that delivery is incredibly important and should never be left out. And then finally, health literacy. Individuals emphasize the importance of health literacy and digital peer support. Potentially, there is a checklist of things that are basic digital health literacy. Communication with and extracting information from members in a medical field is definitely a challenge for peer support specialists and may not be aligned with their values and principles. And so understanding what those types of things are for a peer. And also incorporating more knowledge around digital peer support in communication with medical providers, especially during a pandemic. And so I thank everyone for joining us. If you check the resources in the below section on here, you will see a guide for all of the competencies and how they could actually integrate it into real practice and how they align with SAMHSA competencies and peer support. And then also the research article as well that defines how this project went about by the team. So just want to thank everyone for joining us. And of course, feel free to reach out.